So I'm curious as well. Like obviously, I want to talk about in a few minutes, like some of the changes that people might see from properly handling this. But I'm curious too, and we see this with lots of different conditions that there's sometimes symptoms that we don't realize are symptoms. And I guess when women are looking at handling these sort of situations, what other sort of symptoms are they seeing? Are there things related to sleep? Like, are there other things happening in their lives? What are other things that could be occurring that maybe they weren't realizing was part of the issue?
Mhm. One of the number one things, I mean, insomnia is always in there, and a lot of women will kind of realize that, but it's the brain fog that really is
Mm.
something that women think that they're just getting older and it's part of aging, and now they can't remember the things that they used to. They used to be able to remember every kid in their classroom and their neighbors, but now they're like, "Ah, what's that kid's name? I can't remember." And so that type of thing is really one of the number one things that affects women that they don't realize is hormonal.
So when we're looking at, I guess, getting the right treatment here, like obviously this isn't medical advice, but we're having a conversation about, how these things can be confronted. When we're talking about that process of starting on hormones, is there kind of, some initial changes, like maybe we need a little bit more of this or this isn't as effective? Like, I guess, how does that work in terms of, finding what's right for the person?
Absolutely. It does take a little bit to get the right dosing. At our practice, we have you get your blood drawn before you actually see a provider. And so when you come in for your first appointment, that provider has your blood work already, talks to you, finds out what your main symptoms are, concerns are, and then designs an injection for you that you get that day. So that's kind of what we do. We have you feel better from day one. And then from there, you're going to draw their blood again and just look at how you can tweak the estrogen and testosterone. A lot of it is based off of their symptoms. So we don't just go by blood work. So if she's still having hot flashes that are affecting her in her daily living, teaching her class, if she's attending patients, she's a nurse or whatever, then we need to increase her estrogen. If she's having trouble sleeping, then we might want to increase her progesterone. If she's concerned about an increase in acne, then we might want to decrease her testosterone a little bit. So it's a matter of listening to the patient as to what their concerns are, because not everybody's concerned about having a little bit more acne because their sex drive is so much better. So
And,
it really depends on the patient and what their concerns are.
and I guess when we're looking at, the hormone combinations that are being used and things like that, you've been doing this a long time. You have a lot of experience with it. I guess, is there one thing that you're seeing women are needing more than the others? Or what does that kind of look like? And also, when we're looking at things like environmental causes, I guess, what effect are those having on it as well? Because even, the chemicals we use in our daily lives are changing a lot. What do those things look like?
Well, there are a whole group of chemicals called phytoestrogens, and
Mm.
those are in exhaust fumes. So, anytime you smell a fume from a car, then you're being exposed to a phytoestrogen. And the most important thing, they're in every plastic that there is. So, every plastic water bottle that you're drinking out of, you're being exposed to phytoestrogens. And those estrogens work, they're they work against what your natural estrogen will do. So they will block some receptors, but they don't give you the benefit and relieve your symptoms. So there are quite a few environmental estrogens that are out there affecting us.
So I guess when women are looking at that, do you give them advice around maybe changing the type of water bottles they're using or what they're storing their food in? Because I know my wife has always been big on, we always drink out of glass bottles and we always store things in glass because of the things you're talking about. So I'm curious, is that also something you're looking at, maybe helping people make some environmental changes too, so the work you're doing with them is more effective?
Absolutely. We will give them a list of things that we would like for them to try to start eliminating. And a lot of those, just like you said, you should never actually heat food in your microwave in plastic. That's one of the
My
absolute
wife freaks out about that. She's like, no, not the BPA's.
exactly. Yes. And I have a dear friend who drinks water out of plastic bottles, and she's like, "Well, but I recycle." And it's like, "No, that's not good enough. Just get rid of the plastic in every single way that you can." So, and a healthy, clean living diet is also super important, to stay away from any kind of saturated fats and those types of things, is also a super important thing for your health just in general.